Thank you all for being here for this very important dedication ceremony for the Ring of Remembrance. It is very important for Blanchard Valley Health System. It's important for our doctors, our nurses, our associates, but it's also important for the entire community.
We brought together physicians, nurses, patients, family members, the artist community, the mayor, and we created a committee to determine what type of artwork could we create to memorialize this event. In front of me, though, you see some candles. There's 224. And those are the 224 lives that were lost here at Blanchard Valley Health System. When I think of all the things that we've gone through and all the lessons learned and the changes in healthcare, it was unplanned, unpredictable, and it took a lot of people. So when I think of all the challenges that we faced as an organization, as a community, there's a lot of things that come to my mind. But really, when I look back today, I think that word would be grateful. Grateful for the community that came together and supported our associates as they took on the unknown. Grateful for the doctors that went into rooms not knowing what they were facing for the first time. Nurse managing patients, all the staff that managed the care, and all the staff and leaders and the background, just the gratitude for everything that they had to go through, for the families that were here and had to go through the unknown, the gratitude of having your loved one in a facility or a nursing home and not being able to go see them because of all these restrictions, gratitude that we moved through all that over time. And it really took a community to manage COVID and get through COVID and to learn from COVID. And I think that's that gratitude for everyone. I don't know even how to put it into words. It's very powerful, it was very important, and it also showed this community and who it is and what it is, and it's very powerful to see.
I'm at a loss of words in the sense that I wish we could have done a better job, but all we could do was to be there for each other and for our patients. Nobody knew what was going on. We didn't really have any data. We were just really going by, a lot of anecdotal stuff, things that we learned in our practice didn't really apply. Patients were profoundly hypoxic. We were beside a ventilator for hours, proning them, doing everything that we could that we thought would work, and it just wasn't working. We were running out of everything. We're running out of ICU beds, running out of ventilators, running out of nurses, doctors, you name it. Patients were waiting in the emergency room for several days. There would be codes going at the same time, more than 2 or 3. It was really dark times. But we were there for each other, and I felt that during that time, everybody was there for us too. The medical community, sharing information, there was no red tape. I'd be on the phone with my buddies at Cleveland Clinic, at Mayo Clinic, and we'd be sharing conferences with other hospital systems, just sharing what worked, what didn't work. It's a proud moment for us. We thought that it was a time where I was proud of our medical community. We were emotionally and physically exhausted, but we felt like everyone was behind us. Lastly, I just want to say sorry to everybody who's lost someone from COVID, and for everybody who's still suffering from disability and debilitating symptoms from long-haul COVID. Every single one, in my heart, I wish we could have just done maybe a little bit better, save one more life. So I am sorry. Even though you may not have been able to go to your loved one because they were dying, and we had all our restrictions. Our nurses, our palliative care nurse practitioners were holding their hand when they were dying, and I was witness to that.
I was asked to speak with you today about my experience as a nurse during the pandemic on the COVID ICU. How do you talk about an experience that you wouldn't want anyone to see? A topic that took everything inside of you not to take home, to relive something that is burned into your mind. The truth is, it is difficult to put into words the devastation that we saw and experienced. but more easily to remember the light in the eyes of the people who kept you afloat. I took a displacement on the COVID ICU, and it quickly became an impression that would shape my nursing career. There were days that felt like weeks, moments that made us question our existence and everything we knew about our practices. We went from room to room, putting out fires, changing our PPE through the process, and doing what we could to encourage our patients. Some days, that's all we could do. I will forever remember each hand that I held and the look in the eyes of my patients as they fought for their lives. This memorial to me will forever be a reminder of not only every patient and their families throughout the community affected by COVID, but a reminder that love will hold us together. A reminder to be our brother's keeper, and that even in the dark, we can still be the light.
The night that I brought Fred to the emergency room, I'd never seen anything like it. We came in, and he was checked in, and then we were taken to a waiting room. And when we walked in, I was shocked. There were people coughing. There were people throwing up. There were people gasping for breath. There were people begging for help. It looked like, you know, some nights you see the nightly news and there's those third world countries where people are dying and suffering. That's what it looked like to me. I'd never seen anything like it. It was totally unbelievable to me that that many really sick people could be in the same place, and it was our hospital. But the thing that really impressed me the most was the staff. They worked tirelessly. They were so professional. They were so kind, and they were so caring. And this went through the whole evening. There was this ebb and flow. The waiting room would start to clear out, and then what looked like a bus load of people pulled up, and in they all came again, and that cycle started again of all of the sick people. And I was there until about 1 o'clock, and I assure you, they remained professional the entire time and helping everybody. And I got a phone call, and I answered, and the voice said, "Is this Vicki Rosebrook?" I said, "Yes." And she said, "This is Blanchard Valley Hospital, and your husband is in distress. He's not doing well at all. We need to know if you want us to perform life-saving measures, and we need to know now, like right away." And before I could even take a breath or say anything, she said, "It's too late. He's gone." COVID, or the monster, as I called it, had taken my husband. My partner of 45 years was gone to COVID. I don't remember anything until noon, and the phone rang, and I thought, I'm so glad the chaplain's going to call me. I could sure use somebody to talk to. I picked up the phone, and I heard, "Is this Victoria Rosebrook?" I said, "Yes, it is." The voice said, "I'm sorry to inform you, your test came back positive. You have COVID." Oh, no. I was so filled with grief. I didn't know that Christmas went by, New Year's went by, my quarantine went by, and I realized I had survived COVID. But I wasn't really sure that I was happy that I had survived. I was alone. I was sad. I was grieving. I had to figure out what it is that I wanted. And I decided I wanted courage. I wanted the courage to go on. I wanted the courage to do the things I feared doing. I just needed the courage to move forward a little bit. So I started what I called flexing my courage muscles, just a little bit every day. So this ring of remembrance is for all the workers here. It's for those of us who lost loved ones. It's for the loved ones we lost. And it assures me especially that Fred isn't just a statistic. He's not just one of the over 1 million lost in the United States, or one of the 42,000 lost in Ohio, or one of the 284 that were lost in Hancock County. This will help us to always remember him and all of those who were lost in Hancock County.
It was exactly to the day, 2 years ago today, November 1st, 2020, that I had been fighting COVID for over a week, and after an ambulance trip, I was admitted in the early morning hours. I'll never understand why I'm standing here speaking to you as a survivor. I recall very little of my early days in the hospital, but what I do recall is that somehow hope continued to speak through all the pain. The ambulance ride had terrified me. I knew that it meant things were bad. I knew it was bad because my body was craving air that it just couldn't seem to get. But I recall that night, in a moment of clarity, I looked in the eyes of my husband and of our teenage son, and I made them promise they would never forget how much I loved them, and that they would convey the same message to my mom, to our other 2 boys, to our daughters-in-laws, and to my beautiful grandbabies who I was afraid I would never see grow up. I was terrified and in desperate need of hope. And hope arrived. It arrived. It arrived first through the hands of the caregivers, the doctors, the nurses, everyone at the hospital, the ones who reminded me every day how important it was to fight, the ones who kept in contact with my family, and who patiently tried to help me get comfortable. On one of the days when things went from bad to worse, I vividly recall my nurse on duty that day, and she sternly reminded me that I had to fight in order to avoid the ventilator. And on behalf of myself and all the survivors, I cannot say thank you enough.
Thank you so much for coming up here and sharing your stories tonight. They're powerful and impactful. And I know that you only got to share a glimpse, just a little glimpse, of what you felt and what you experienced and what you endured. And last but not least, before we start the dedication, I would love to give our gratitude once more to the doctors and the nurses and the administrators and everybody, the respiratory therapists, biomed, EVS, who cleaned and sanitized the rooms, central transport, scheduling, basically Blanchard Valley Health System, for everything that they did to fight COVID tirelessly and never give up, even when they are at the point of exhaustion and devastation themselves. So just a real round of applause.
As we join together in this moment of silence, may we also take a moment to reflect and to remember all of those who gave selflessly of their time, their talent, their energy, and the service to others, to remember those who are no longer with us in body, but forever will be with us in spirit and in stories, and also to remember, in the words of the poet, that no matter what you are going through right now, you are not alone. We have each other. So if you would, please join with me now in a spirit of prayer and reflection.